are kind of flying blind because there haven't been enough tests done. We're going to try to change that, and I think that that will make the fight against COVID-19 much more effective. I think it'll create, I think it'll help people in terms of public health, but I also think it'll help the broader society get back on its feet as we defeat this and move past. I want to let Jared say a few things as our emergency management director, since he was really instrumental in getting this going.
Governor, thank you. It's surreal to be back in my home county setting up a testing facility for a virus, but that's where we find ourselves. Through the governor's direction, we have been working day and night at the EOC at a level 1, trying to acquire as many of the commodities that we have all been reading about and making ourselves experts on N95 masks and the like. So we have requested with the federal government for ventilators and hospital beds and coveralls and gowns and gloves, collection swabs, but we are also going out on the private market to trying to acquire all of those different things on our own. And so we currently have procured 1,500 ventilators. We are waiting for deliveries. We're getting deliveries every single solitary week on the ventilators. We have 4 250-person mobile field hospitals. One of them actually is being set up right here in Broward County right now, and that'll be open if it becomes necessary. One other one is being moved near the villages, and the other 2 are pre-positioned in Orlando, waiting for possible deployment. We're examining all sorts of different ways to expand bed capacity here in the state. And so I know the president, the vice president, we're talking about surgical centers and using their capacity since they have ventilators. But we are also looking at using our ports potentially at bringing in certain sort of ships to expand bed capacity if that becomes necessary. So there is no option that is off the table. A way emergency management works is you're not just thinking about today, you're thinking about 2 weeks from now, 30 days from now, 45 days from now. And so we're going to work really hard to make sure that we can get these other testing sites up and running. I want to talk to younger people who are out there, who even, whether things are open or closed, you don't have to go out. You can be a hero to the person next to you by social distancing. You don't know if they have an underlying medical condition. Stay away from seniors. Social distance. You can do those things. This virus doesn't care who you are. It doesn't care if you're rich, you're poor, your color, your nationality, your religion, your political affiliation. But we do know that social distancing works. And so we ask that you do that. We ask that you be a hero. There will be another spring break when this is over. The beach will be there. But it is important to do that. Call your neighbors. If you know you have seniors that live down the block from you, call them. See how they're feeling. See if they need supplies. These are things that you can do as the younger generation to help older people that came before you. And so, we ask that, now is the time for everyone to help themselves, help each other. I want to thank Governor DeSantis for the leadership that he's providing to the state, because we're all in this together. Governor, thank you.
So we'll be making another announcement in the morning. We've been consulting with the local folks here in Broward, as well as in Palm Beach County. If you look at that most recent guidance that was put out by the President's task force on Monday, it had a number of things in terms of social distancing, some of these other recommendations. If you look at the very bottom in the very fine print, it said that there were certain actions that communities should take when there's community spread. And so the county has been working with us on identifying kind of those actions in terms of additional closures, like gyms and things like that. So we're going to be working on that order tonight, but I've agreed to do it for Broward and Palm Beach counties. And it'll be similar to, I think, what's been done in Miami-Dade County. And again, that's based off the recommendations of the local officials, but also the CDC recommendations that when you do have community spread, then there's additional items that should be on the list. So that will apply Dade has already done it. It will apply to Broward and Palm Beach. And if you look at the cases in Florida, it's a clear majority of cases are in those 3 counties. We have many counties that still don't have a single case, and we have even some large counties that are still in single digits. Now that may change as the testing expands, but nevertheless, I think Southeast Florida is the epicenter of what we're fighting in Florida, and so we want to work constructively with the local folks, and if that's something that's going to be beneficial and the CDC recommends it, then we're happy to help with that. And with that, I'll take a question or two, but I got to get back and run.
Governor, you just said they were going to send testing pods to affected areas
Yep.
from the Department of Health and
Yep.
Human Services. Is Florida one of those? Is that what you just described up in Jacksonville?
Yeah, exactly. So what it is we provide the personnel, but they will provide, theoretically, I hope it's true, all the stuff you need. So the swabs, the PPE that people wear, to be able to run these sites. Jared is also working with some private vendors who may also be able to fill the void, because I think it's great to have the Miami Center, Jacksonville, Orlando, but I'd like to see a lot more pop up around the state. Now, we do have some private ones that have popped up. Some have been successful, some not as successful, but I think having this would be good. I'm willing to put more National Guard folks into the fight for those things. And then Jared has also procured a number of medical personnel, nurses and the like, a contract for their services. So we'll be able to bring in additional healthcare professionals as well to help staff that. And I think if the private lab capacity really goes up exponentially like we think is going to happen, or we're told is going to happen at the end of this week into the beginning of next, and as more of the Florida-based labs are able to process, even if they can only do 100 samples a day, we got probably 50 of them that if they're able to do that adds your numbers. Then you're in a situation where you're really testing enough to have a good idea exactly how this virus is reacting in the state of Florida. Well, so I spoke with the chairman of the tribe this morning, and as you know, they're sovereign. You know, they don't have to follow what the state of Florida decrees, but they did implement my directions regarding bars and restaurants voluntarily, and they've implemented a number of far-reaching social distancing measures for some of their other operations. They conveyed to me that the safety of their workforce is paramount to them, and that they will only operate if they can do so safely. And so that's, I take them at their word on that. But obviously, we want folks to heed the call with the social distancing. I think that's one of the most important things. And this is a virus that is it is invisible, it's contagious. But if you're 10 feet away from somebody, and you're protecting yourself, you're going to be fine. If you get in a group of people that are close by, then it becomes much more difficult to be able to guard against it. And so a lot of that is voluntary guidance and decisions that some of these decisions by the governments can kind of inform. But ultimately, I think it's up to people to make those key decisions so that a couple weeks from now, we can say that this thing hasn't taken off like we feared, and then we can really, I think, hopefully get things going in a better direction in terms of the economy. Let me just say this, too, about the economy. We were in a situation in this state. In fact, the unemployment numbers that hit my desk on Monday, now they didn't reflect the fallout from the previous week with the virus, but the unemployment numbers in Florida were 2.8%. The state was rocking and rolling. We had a lot of people doing very well, a lot of people wanting to come down here, partially because it's a great state, but partially because there was economic opportunity. This virus has been really an external shock on the economy. There's going to be a lot of our friends and neighbors who, through no fault of their own, maybe they get furloughed, maybe they get completely let go, and they're going to need some assistance, particularly some of our lower wage workers who work paycheck to paycheck. So what I'm doing, one, we're going to turn on and seek whatever types of financial assistance we can for displaced workers. And we are also turning on as much aid to small businesses as possible. You know, some of these small businesses were doing well, but if you just totally take everything away from them, they don't have unlimited cash on hand. And so that crunch happens very quickly. And I think it's a shame if we have our friends and neighbors go out of business through no fault of their own. So if we can provide some additional liquidity through some of our programs, some of the federal programs, you know, that could make a huge difference, and that could allow us to bounce back quicker economically. Jared and I are going to be seeking the disaster unemployment assistance through FEMA, which is beneficial. And then I've instructed my folks at the Department of Economic Opportunity to cut through all the red tape, waive any restrictions about you got to apply for this many jobs. Normally those are good because you want people to seek work first, but in this case with the shock to the system,